This interview is brought to you by NTT Data. Federal health agencies work tirelessly to protect us from health and safety threats that arise at home and abroad, so we work tirelessly to bring them reliable, cutting-edge IT to improve productivity, leverage data, and save lives. As a top 10 IT service provider, NTT Data can help your agency put modern IT solutions into motion with our proven end-to-end practices, platforms, and services. Together, we can streamline government operations, implement AI successfully and responsibly, and improve public trust. Visit nttdata.com.
Hello and welcome to HIMSS 2025. I'm Sylvia Oakland, staff writer with GovCIO Media and Research. With me now is Mariann Yeager, the CEO for the Sequoia Project, a nonprofit that's dedicated to advancing secure and interoperable health data sharing. Mariann, thank you so much for joining us.
Oh gosh, Sylvia, thank you so much for inviting me.
I'm really excited for this discussion.
Yeah.
I think the first big question that I have is about interoperability and why is it so important?
Well, if you think about interoperability in less technical and mechanical terms, it's really very simple. It's about making sure the right information is available when and where needed at the fingertips to make sure that clinicians and those caring for patients and populations have the information they need to really improve health and welfare for everybody. It's just so foundational, and there's a lot of discussion this week, about artificial intelligence and other things, and all of that needs good data, and so that's really part of that equation as well.
Yeah, we always hear data in, data out.
You bet.
You only get out what you put in. It's one of my favorite sayings. So I think the next thing that I'd like to talk about is, there's a lot of healthcare jargon, and when you get into IT, you also get a lot of jargon.
Yes.
So in these two jargon-heavy fields, where can plain language and digital transformation kind of be implemented to really help patients understand their health record rights?
It is a great question. And, when someone is in need of their health information, it's usually in the midst of a health crisis or chronic health problems, if not for themselves, loved ones. And it's really hard, just even emotionally, to navigate our complex healthcare delivery system. And so what we found, we actually, just to provide some context to this, we actually convened a consumer voices group about a year or so ago. And the whole goal was to bring just average people from all walks of life, all different parts of the country, and to really understand, in their words, what their experience was trying to navigate and get information for their own health and that of loved ones. And the shared experience that was really universal was it's really difficult to understand what one's rights are, and to how to, really thoughtfully know how to navigate and get access to the information. And the key to really changing that is twofold. One is to have resources, toolkits that we make available to those who treat patients so they have, basically resources to share with individuals who need access to their information, and also to work with those who do have those individual and patient relationships to communicate and educate so that they understand their rights. It's going to take some time. It's a cultural issue. It's a human issue. And it's one that we're very passionate about because in the end of the day, it's just absolutely essential to make sure people are empowered with the information they need to, manage their own health and that of their loved ones.
I was listening to one of your previous interviews where you talked about, the meaning of the name of Sequoia Project, that interconnected roots and having that power of many just to make sure that we can treat everyone, and really having that accessibility, just in the sense that everyone understands from patient to provider what is going on, and those in that healthcare circle. Absolutely. And you touched on something that I think is, like you said, is going to take a little bit of time, but how do we continue to break down the barriers that prevent true interoperability?
Well, for us, it's not a one and done. I mean, there are a whole litany of issues that we need to address to break down barriers to interoperability. I think first, of course, is having informed, patients and caregivers. Another one is to actually make sure that the information is being exchanged. A lot of times when we talk about interoperability, it's the mechanics of how does information get from point A to point B. But importantly, it's also important to consider that the information is actually useful to the person who needs it. And so we've actually been spending quite a bit of our focus in bringing together a group of experts, end users, clinicians, to help identify and refine, what are some parameters, guidelines to make information more usable. And for us, that is so foundational. And there are many other challenges and issues to interoperability that we focus on, but those are really top of mind. Another one, when we think about the current landscape and how increasingly complex the web of privacy laws are at a state level, is, how do we have the right privacy and consent constructs in the U.S. to support this modern healthcare ecosystem. And so we just published a white paper on that just a couple weeks ago, because we do believe that that's an area that's going to require further consideration, definition, and focus. And it's to make sure we're modernizing the policy framework in which we're all operating, and it's operational and something that is, also respects the rights of individuals.
Yeah, so really taking that holistic approach,
Absolutely.
Making sure it's both from a policy perspective, from those who are on the ground, just really, I believe it was a top-down approach that might be a little bit better, or correct me if I'm wrong.
Well, I think we look at it, you kind of need a balance of both. There are times we need top-down, can sometimes be where there's a clear answer and but we tend to be more organic and grassroots-oriented, and trying to bring together various perspectives to sort of solve these shared issues for the public good. And it kind of is akin to the analogy of our name. Sequoia trees they're able to reach these great heights because their interconnected root systems support each other. And that for us means bringing the community together to really shore up and come up with the things that can help us achieve those great heights.
Yeah, I'm so excited to hear, what else is going to be happening with the Sequoia Project.
Yes.
And my last question for you is, we talked a lot about how there's just so much data when it comes to, someone's healthcare records. So how do we make sure that healthcare professionals can focus on making their data valuable?
It actually gets down to kind of brass tacks on this issue. To make information usable, it really needs to, there has to be more consistency in the sort of terminologies that are used, vocabularies, et cetera. And it's actually really achievable, but not in one fell swoop. It's not as though it's a one and done, to try to normalize all the ways in which data are represented and then subsequently shared, because we need consistency to have that. So for us, it's been a long-term approach to, again, publish an implementation guide that people can implement, and provider organizations and others and payers, et cetera. And then more and more we can improve the consistency and usability of information over time, the better we'll be. But I'll tell you what, when the Sequoia board took on this issue and prioritized it, they said this is not a 1 or 2 year endeavor. This is going to be at least a decade. And it might not seem super exciting, but we know it's super impactful and we're all behind it.
Yeah, we just have to take it one day at a time, one record at a time.
Absolutely.
Mariann, thank you so much for joining us today.
Thank you, Sylvia. It was a pleasure.